Welcome everybody. Welcome to this self-help video course, Curing Your Dpdr. I could also say, welcome to this golden wall behind me, because you're going to be seeing a lot of it. There are a few videos that I've shot in my practice, in my office, but most videos will have this golden wall. First of all, you can heal. Hundreds of people have preceded you, and there's no reason why you shouldn't be able to heal just as easily. There is no magic wand. My job is to dispel myths, to debunk misinformation, and to give you the information you need. Let's talk about some of these myths or debunking misinformation things. First of all, a lot of people say, it just takes time. When somebody says it takes time, these people really do not know how. What are the individual steps that you need to take, and what is the process? Once you know the process, the steps become obvious, and you can take them one step at a time. Another piece of misinformation is the confusion between Dpdr and depression. A lot of people say they have Dpdr and depression. Ask yourself, did you have any depression before you had Dpdr? If you did not, you do not have a primary depression. That means if you try to treat your depression which came from the Dpdr, a secondary depression, as if it was just a depression, it will not work. It's quite normal for people who have Dpdr to feel very powerless and a lot of grief around their Dpdr. But that is just a secondary depression. It can be lifted very easily. It can be cured very easily, the secondary depression. Let's not focus on the secondary depression, because that's a dead end. The hardest thing for people with a self-help course is not having the feedback from somebody who says, yes, you're doing the right thing, or this is normal, this reaction is normal. Now, are you doing the right thing? I'm going to assume you're just going to follow video after video after video. Is your reaction normal? Well, first of all, your personal reaction is undeniable. If you get emotional, you get emotional. Just observe what your reaction is. Take it seriously. If you don't get a reaction, that is something you observe, and it's undeniable as well. Look at the intensity. In a lot of therapy forms, we talk about the subjective unit of distress. Just measure it. Is it a little bit of a reaction? Is it a little bit more? Is it even more? Is it maximal? Between 0 and 10, just gauge it. Take it seriously. Next to taking seriously that you have a reaction of one or multiple feelings, adapt your treatment, your self-treatment, according to your observation. Use a mind map if you have multiple feelings at the same time. My advice is, first watch these videos in the general section, in the overview section. And regarding your expectations, watch the videos about the expectations and the ETA, the estimated time of arrival. How much time should it take? How much time does a phase take? See you in those videos.